Hi, welcome to this week's edition of Brand Brew. I'm Rob Rosenberg, president of Springboard Brand and Creative Strategy, and I'm delighted that you'll spend a few minutes with us today. My guest is Donna Arbogast, longtime healthcare marketer, former Springboarder, and former senior VP at Washington Hospital Center. I'll let Donna introduce herself as well. Donna, welcome.
Well, thank you. It's good to see you in the new way that
Yeah,
we
good
see
to see
people.
you. Exactly.
Uh,
How are you?
so,
You holding up during all this?
yeah, I am. And I feel very lucky that, I can work from home. And
Right,
I appreciate all the people who are on the front lines taking care of us so that we can work from home. And hats off to all the
absolutely.
people who are doing that incredible work.
Right, right.
But
Well, I
yeah,
appreciate your being a guest on this week's Brand Brew. And essentially, I really liked your piece about this shift from everyone's talking about the pivot in communications and branding. And you have kind of laid out different pathways. So it's the shift from pivot to pathways in terms of what roads marketers can take. And I was really intrigued by it. And I'm glad you were able to share some of that with
thank
our
you.
audience today. And the first you talk about, you have, I know, the five pathways, and the first you talk about is the whole idea of sensitivity and the need to be in today's environment.
Right, right. So, being in public relations for so long, the first rule of thumb in crisis communications is empathy, but that's an acute crisis. This is a prolonged, long-term situation that we're in. And so thinking about being sensitive in all of our communications and not forgetting that everyone has been affected by this and in sometimes life-altering ways. So we want to make sure that and not just being sensitive to our external audiences when we communicate, but our own internal teams. A lot of companies are doing some interesting things to help their employees through this difficult time from a mental health perspective and connectedness. So just
Right.
keeping all of that in mind as we move forward with any piece that we go out with.
Right. And so we've seen a lot in every market, and I know you're in the Baltimore, DC area. I'm in obviously the Chicago area, and I know we've seen a lot of messaging around the whole idea of we're here for you, and really this whole hopeful bucket of we're in it together and so forth. And so I think when you talk about sensitivity, obviously that's really important, but then it also translates to your next pathway, which is the whole idea of listening, so
Right.
that marketers can fine tune their message kind of coming out of the pandemic.
Yeah, they are definitely connected. And I think as marketers, we are listeners. That's what we do, but it almost has to be listening on steroids, I think, right
Hmm.
now, and in a way that
Hmm.
not just listening to what people think, but understanding how they're feeling. Going back to that
Hmm.
being sensitive, but we can certainly use surveys. People are trying very short ones, very focused questions, but I think we can do a lot through social media right now. And I was
Right.
thinking about when you look at what people are posting in response to your own accounts or to your competitors or even organizations you admire, what's gaining traction? What are people sharing? What are they angry about? What's
Hmm.
making them laugh? And I think that
Right.
can give us some insights into how we can proceed with our messaging throughout this process.
Right, right. Well, that makes a lot of sense. And I think you're right. Social media, sometimes if you read those comments that
Yep.
people have, it gives you more insight to the marketplace than a lot of other studies because people are really free to kind of say what's on their mind.
Yeah,
So
they really are.
that
And
is kind of a difference. And then you also talk about, and I really found this one very fascinating, the whole idea of new paradigms in terms
Mhm.
of how organizations are maybe viewing their former competitors.
Yeah, I think everything that I'm reading is making it seem like this is a bit of a tipping point in how we're going to approach, and of course I think of it always in healthcare, but I think any business can think about this. What is happening in the world that is going to cause us to look at our traditional competitors and how we can collaborate? I know here in DC, there have been a lot of competitive systems and hospitals that have come together to provide care because one hospital might be ideal for the critical care and others may be better for those patients who needed just ongoing care, either because they thought they had COVID and weren't diagnosed, or they had need for other kinds of services ongoing. So the collaboration piece, I think, is a really important opportunity. Collaboration between hospitals and systems, between maybe retail health settings that are going to become more important, nonprofit healthcare organizations that, associations, and even insurance companies and technology. All of those are going to be able to come together and try to meet the new needs of our consumers in the next wave of COVID, which I guess we're probably going to have to deal with,
Right.
or as people come back for their elective procedures and kind of come back in a large scale, or as people need mental health services that go beyond our current capacity, how do we collaboratively support that? And then particularly with people with underlying conditions, and they have an ongoing risk of COVID, so how do collaboratively we meet all of those needs in a whole new normal?
Right, right. Well, and that's interesting in terms of, as you said, I certainly experts have predicted another wave coming down the road. But right now, as people, as you're saying, are coming back to, and hospital and systems are opening their doors for the elective surgeries and some other procedures, one of your other pathways you talk about is the need to really create value for patients so that they'll understand uh, or feel better about, in fact, coming back. You want to elaborate on that one a bit?
Right. Yeah, I think another interesting article that I read was written by, well, it was based on a PwC Health Research Insight survey.
Right,
And
right.
they did a survey of 2,500 people during April, and then they compared it to the pre-COVID results. And it was really interesting that the conclusion they came to is that, again, this might be another tipping point where healthcare providers and others can begin thinking about um, how do we offer ourselves as resources? How do we not just offer what our brand has traditionally offered, but is this a chance to think about helping people manage their chronic disease, helping people prevent illness? They recommended that hospitals and systems begin less of a transactional type of communication and going back to more relationship building, loyalty
Mhm.
building, and creating a value around the service that they provide, not just in terms of we're offering the best, or as we always do in marketing, we talk about our differentiators, but what is really going to matter to people going forward as they try to manage their own health and get healthier, get our country healthier. I think there's
Right.
really an opportunity to be a resource, to use our listening to meet a need that isn't the traditional, or maybe isn't what we had been doing before.
Right, right. And really, I think in terms of that particular pathway, it's helping individuals understand and maybe educating them on what they should be doing and how the organization is in fact creating a safe, comfortable environment for them right now. I think is going to be
Right.
really key to encourage people to, in fact, come back to their healthcare institutions and follow up with those things that have been on their list.
Well, and that was one other piece of that survey, is that hospitals and systems have a high level of trust right now during this COVID
Right.
crisis.
Yeah.
And can we leverage that? Can we build on that trust? Yes, to provide them with some long-term care and support and resources that we haven't been doing before. One other small piece about that, or I won't go into great detail, but part of that conversation was around telemedicine. Now, telemedicine obviously is sort of a no-duh. Everybody's using it because it's so much more convenient. But this article also went into how about telemedicine as a way to help with managing chronic disease, a way to help people prevent? And then, is there a way to expand our workforce, become kind of a primary care network workforce, from using people who are out of jobs, training people into new positions, and using that telemedicine tool to touch base with people as they try to manage diabetes, as they try to manage heart disease. Kind of using telemedicine and the fact that it's now clearly a way to replace a doctor's visit, and people are beginning to accept that, but is there another place for it, and in an expanded way? And then can that also be something that brands can use as they build this value, as they offer
Right.
themselves as a resource.
Right, right. No, good points. And then your last pathway almost brings us back to where we are today, but I know it kind of takes a different spin, which is really celebrating the community. And maybe the difference is celebrating the internal community, which we're doing today, and thanking our healthcare heroes. But as you're talking, it's really about celebrating the community and the health of the community as one of the pathways organizations can shift their brand.
Yeah, I think it's really interesting to see a lot of companies begin to realize they are part of the community, and so celebrating successes it is really an important opportunity. I think here at the as COVID continues and as we deal with all of the impact, I think we're used to celebrating our internal successes, but we can now become a positive force as our country makes a shift and as our communities make shifts to get healthier and to live in a way that we recognize we're all in this together. And so I think that's another opportunity for communities to come together and celebrate the small wins.
Right,
You
right.
see it a lot with organizations sponsoring virtual concerts and virtual celebrations of anniversaries, and it's a way for all of us to participate, and I think companies can do that and build their brand.
Yeah, well, great. Well, Donna, thank you so much for joining me on this week's edition of Brand Brew. And as part of our custom, we talk a little bit about our coffee mugs. And I know you're in Baltimore, but I'm a big Steeler fan. And I'm also, I'm really looking forward to some sports. And so I'm drinking my
Yes,
Hall
how
of
we're going
Fame
to do
Steeler
that.
mug today. Yeah. How about what kind of mug did you
Well,
bring today?
I wish I had a Ravens mug, but
Yeah,
being
glad
in
you didn't.
Baltimore and
Yeah,
really
yeah.
missing that. But I have to be honest, I've gone through a declutter spurt, and maybe this was even pre-COVID, but I'm using my boring old mug that's sort of simple and elegant, and
There you
but
go.
if I could put a little purple on it, I would.
Well, good. Well, this will be primarily as we do shown on LinkedIn. And if people have any questions for you, Donna, we'll make sure to put your link. And
Okay,
really always enjoy working with you and collaborating, and many more in the future. And again, thank you so much for joining
thank
us. And I
you.
hope all of you have enjoyed today's Brand Brew and taken a few minutes to enjoy a cup of coffee and learn a little bit about brands and how they're pivoting coming out of the new pandemic. And Donna's pathways, I think, give us tangible directions to go with that in mind. So thanks again.
Thanks, Rob. Bye-bye.